So good afternoon and welcome. My name is Connie Burke from the New York State Office of Addiction Services and Supports, joined by my colleagues from DOH and to be joined by Chris Smith shortly as well from OMH. He does have another meeting that he has to attend this afternoon, so we'll be late. So just a couple of housekeeping items before we get into introductions. Please know that we will have time for question and answers. That's one of the reasons why we have our community meeting quarterly. Please be aware that there are a number of folks who have joined this afternoon, so we do ask that you use the chat function to post your questions, and we will go through those questions shortly. So if you already have a burning question, please feel free to drop it in the chat. If not, and something comes up, know that we do ask that you put your comments and questions in there for us to see and share and respond to. I'm sharing my screen. Hopefully folks can see. I'll look for a nod from David or Val because those are the two I can see. All right, thank you so much. Okay, so I want to jump right into introductions. I've already introduced myself. I do want to pass it to my colleagues at DOH. I'm going to start by introducing David Holtgrave, who is a special assistant to Dr. McDonald at the Department of Health. And I will pass it over to you, David.
Great. Thank you so much, Associate Commissioner Burke. My name's David Holtgrave, Special Advisor to the Health Commissioner, as Connie said, and I will pass it to Val White, the Deputy Director of the AIDS Institute. Val, over to you.
Hi, good morning, everybody. Nice to be here. As David said, I'm a Deputy Director at the AIDS Institute, and one of the areas that I oversee is the Office of Drug User Health. And I think Tina Kim is also on.
Good morning, everyone. Tina Kim. I'm the Deputy Commissioner for the Office of Health Equity and Human Rights, where the AIDS Institute is based within the New York State Department of Health. Great to be with you, and I apologize for not turning on my camera as I'm under the weather, so I will spare you all, but I am here, so thank you.
And we also have Shaimei joining us from DOH.
Hi, everybody. I'm Shay Gonzalez with the Office of Drug User Health. I'm one of the health program administrators. Nice to see you, everybody, again. Pass it back to you, Connie.
Great, thank you. So we also have Lucia Clark, who's our project director here at OASAS, overseeing the Opioid Settlement Fund, and project coordinator Denise Gagno. So if there are any providers on, you know these two. You've been working with these two. You have frequent communication with them. So I wanted to just take a couple of minutes to talk briefly about the Opioid Settlement Fund Monitoring and Reporting Plan. Please be aware that this is information that we had shared at the most recent Opioid Settlement Fund Advisory Board meeting, which took place on the 24th of February. I hope I got the date right. And so know that this information had been presented at the board meeting. The full slide deck is available on our website. I'll get to that a little bit later. But just wanted to use today's meeting to just do a quick level set in terms of the fund and our planning in terms of monitoring and reporting. We're not presenting data items this afternoon, just for awareness. This is, again, a high-level oversight. And following this and a brief mention of our website, I know that David also wants to say a few words. So, and following that, we'll have questions and answers. So jumping right in, I think that one positive that we've seen after looking at the data for 2024 is that there has been a decrease in overdose deaths. As you look at the slide, you do see that there is a drop between 23 and 24. A positive sign, although this by no means says we're out of the woods or our job here is done. And I also want to point out that there have been, tremendous efforts by the state on the part of the federal government with their naloxone saturation plan. There could be innumerable reasons why we've seen this downward turn. Note that in showing this, I'm not indicating it's any which one reason or group of reasons even, right, as to why this happened, but this is a positive downward turn, and of course, our hope is with all of our efforts, we continue to see this number drop in the coming years. With regard to the opioid settlement altogether, we just wanted to do a quick level set and help people to really understand when OASAS is talking about these dollars and the opioid settlement fund, what that means, and to the extent that we are able to monitor, evaluate, and then report out to you in terms of how these dollars are being used. So as you see on the screen, we have this pie chart which shows you that of the entire settlement amount that we have coming into the state, if you look at the two sections of the pie that are purple, you see that constitutes 36.4% of the pie. So know that those are the dollars that are the opioid settlement fund. Those are the dollars that do pass through OASAS, and the dollars that we use for two purposes. One, discretionary spending. So what I mean by that is the projects, the initiatives that we're rolling out using these dollars. A reminder that for all those initiatives, they're informed by the board's recommendations, and those are opportunities for us to include both OMH and DOH providers as eligible applicants in the work that we're doing and that we're rolling out. So know that as I talk about the reporting piece coming up, that we're talking about this 34%, and more specifically that 20% of the pie is what we're going to be reporting out on. The other portion, the regional abatements, are the dollars that pass through us to the counties and other litigating entities. It's provided on an annual basis. We do ask for annual reporting from those entities in terms of how they're using those dollars and spending down. And that information also is in part posted on our webpage. I'll get back to the webpage a couple times this afternoon. In addition, I also want to point out to folks the fact that there is a direct share portion of the settlements, and that direct share are dollars that do not pass through OASAS. Those are dollars that actually go to entities directly. As you can see, New York City receives 20% of the direct share and 20% of the pie, if you will, there, the whole pie. Nassau County receives a 6.7% allocation, and Suffolk an 8.6% allocation. And then you see there's another piece, that 10.8% labeled subdivisions. Those are dollars that are direct share, and they go directly to counties, excluding New York City, Nassau, and Suffolk. And it gets further complicated by restricted versus unrestricted share, and I'm not going to get into the fun of that. But there's even further designation within each of these pies in terms of, in each of these pie pieces in terms of restricted, unrestricted, and rules around use of these dollars. So again, I really want folks to recognize that 36.4% of the pie that OASAS oversees, and the 20% that is the discretionary spending, which I've talked about and that you see here. And in terms of that discretionary spending, that 20% of the pie, we do have an OASAS evaluation team that is working with us in terms of developing data reporting tools, collecting data, and really understanding and evaluating the impact of those dollars over time. We also have a contract with New York University through the Government Academic Partnership RFA that was issued in 23, I think, 23 or 24. And know that that's a 3-year opportunity whereby we're asking NYU to work in partnership with us to assess the regional abatements. So again, those are the dollars that do pass through OASAS, and they go directly to LGUs across the state. And those dollars are what we are asking NYU to help us evaluate and understand how they are being used. In terms of developing initiatives and monitoring the impact, know that we start with our environmental scan. Again, we do take the recommendations, the priority areas that are established by the Opioid Settlement Fund Advisory Board. We look at what our needs assessments have told us in terms of the need for services. And really, it's about identifying gaps and also recognizing where there is heavy opioid burden, and then targeting, directing our initiatives and our funding to all of those aims. Know that we have developed these initiatives. There is information about each of them on the OASAS webpage. I will add that for the dollars that pass to DOH, they also have an opioid settlement fund tracker on their webpage, and we'll get that link actually and put it up in the chat so folks have access to that, and can therefore, after the meeting, go and look more deeply into what are the initiatives, who did win awards, and you'll see more information about how these dollars are being distributed across the state. We did issue RFAs to make these dollars available, and again, working with our evaluation team, have implemented data collection tools, and we're monitoring the service delivery. So recognizing that, you know, those first couple of steps in this diagram in terms of doing the scan, identifying the needs, you know, collecting the priorities and so on, it does take time. And with regard to the implementation, we did intentionally fund providers for a period of at least 3 years. So they would have a 3-year implementation period in order to really allow them time to gear up, get in a strong position to deliver services and respond to the needs of the community. So this also speaks to how long it takes to spend the money, right? It's a 3-year contract or a 5-year contract. They need the time to spend those dollars down. And then finally, with the reporting and monitoring, we want to know, how are these dollars impacting the issue at hand? And again, part of our work that we're doing with the evaluation. So as I mentioned, we've developed new data monitoring and reporting efforts, primarily led by Ashley Jordan, Dr. Ashley Jordan, who is our Director of Research and Evaluation here at OASAS. As we continue to develop initiatives, we all know that this is funding that's going to go on for a number of years. We will follow suit in developing data collection tools that are appropriate for measuring the outcomes and the impact of the dollars. We do want to understand how the dollars are being used based on the 10 priority areas established by the board. We also are looking at specific initiatives. So even at the project level, you know, there's the macro of looking at what's the impact of the dollars overall, and then there's the impact, you know, of each initiative, each specific type of service delivery, given the aim of that initiative. And of course, we do want to continue to monitor and keep an eye on priority populations and geographic areas to see if our targeted use of dollars is having an impact. So we do at this point have a year's worth of data for a handful of projects that started, let's see, well, we issued RFAs in 2023. Know that we do ask regularly about the use of funds. We collect data on actual service delivery, so we're getting a sense of what is the volume and the amount of services delivered. And also, you know, wanting to really ensure that engagement is happening, right? Folks are going out there, they're providing services. Are they actually reaching the individuals that are targeted? And again, we're monitoring those outcomes. Another way to understand and know how we're monitoring this work is through our public dashboard and data. We have listed on our webpage the Opioid Settlement Fund Advisory Board reports, We have our online spending tracker, which you can sort in a couple of different ways. I would love for someone on my team to take a shot at the QR code and make sure and tell me that it worked, because I always question whether this stuff really works. So know that we have all of this information, and as our evaluation evolves, we will continue to update the web page and provide additional information. For awareness, to date, we have data for the list of projects mentioned. If you've been joining us regularly since this started in 2023, you'll remember some of the things that we started with. Low threshold buprenorphine was an initiative. That was our first RFA that we issued. Outreach and engagement, connections to care, non-medical transportation, which is so critically important. Harm reduction delivered, that includes the availability and the provision of both naloxone and test strips, so xylazine and fentanyl test strips, and then our scholarship and paid internship program. So know that this is the first set of initiatives that we're collecting information on. These are the ones that have had at least a year of implementation, so we have some numbers to look at. I'm creating a little bit of a cliffhanger here, because the additional information and data around these initiatives can be found on the OASAS webpage. So this is encouraging you to go to the webpage and refer to the slide deck from the most recent OSPAB meeting to be able to see what we have available there. And then lastly, I'll just mention the OASAS webpage. Know that you could go to our main webpage, and you can find a link for the Opioid Settlement Fund Advisory Board page. We have our tracker that shows the use of funds and what's been made available. And then there's also a table and a link here for the actual initiative. So as I mentioned, you can go to the website and learn about what is the initiative. You can see the RFA, you can see who's been awarded and how much funding was invested in each of the different funding opportunities. Similarly, you can get this information for the DOH projects on their webpage as well. So having said that, and hopefully kind of piquing your interest in pivoting and looking at the OASAS and DOH websites in terms of the information we're making available, I will end with my comments, and I'd like to pass it to David, who I know would like a few minutes to speak with the group.
Oh, that's great. Thank you so much, Connie. And thanks again to you and to everyone for having DOH and having me today. I'll take just a few minutes here and make 4 or 5 quick points. I just wanted to start. Kristen, you put a good question in the chat about on the DOH website for the opioid settlement awards. How do we find out the awardees and where they're located? For each of those, it should have a link of number of awards, and then a PDF should pop up with the names of all of the awardees and where they're located. If for any of those we don't have a live link, please feel free to email myself, Val, or Shay, and we'll make sure that we get that to you. So thank you for that question. I just wanted to answer that quickly off the top. And so the first point was related to that, and that is I put into the chat the link to the DOH list of opioid settlement projects. You can see those listed there. They have when the project began, when it potentially slated to end, or at least in its current incarnation, the award amount, a little abstract if you click on the expand for more information, and so on. So that is our most up-to-date list. And if there's anything that you're looking for that's missing there, again, please email us, and we would be delighted to get right back to you. The second thing that I put in the chat, very relatedly, is if you're interested in more information about each of these projects, just as Connie said, from OASAS, the presentation at the February 27th or so last meeting of the Settlement Advisory Board, There's a presentation by OASAS. I did another one on the DOH projects. And if you look at the video of that meeting, that was very nicely posted, and thank you to OASAS for doing so. You can see that presentation, and it talks about the projects. What are we finding in terms of the data so far? And that's summarized there as well. And again, if there's any additional questions, please feel free to reach out to us. And then just a couple of other things that I want to mention. The first is that one of the projects for DOH is a coroner training program, and the reviews for this have been completed for application. The approval for the selected applicants going through the approval process, so I can't announce who that is today, but we're getting close there. And the intent of the request for application was to fund an agency for $200,000 annually for 2 years. And we think the start date should be in fall of this year. The next thing that I wanted to mention just briefly is that there's been a reissuance, or there will be a reissuance, I should say, of the Enhancing Harm Reduction Services in Priority Populations for persons who use drugs. That RFA will be issued in the next few months. We're getting close to that. And we wanted to just mention, though, that and you can see on the website the priority populations. Last time there were no applicants for adolescents or young adults and veterans. So these populations were included in the request for applications, and we're hoping to be able to expand our distribution of the application to other spaces, especially veterans and youth serving organizations as well. So wanted to mention that about the Priority Populations Project. And related to that, one thing that doesn't quite come across in the listing of awardees or the data that we presented at the last Settlement Fund Advisory Board meeting is that the priority populations grantees have been doing a really great job of kind of finding networks among themselves. And what I mean by that is if we're seeing 2 or more organizations come together and serve communities who they may have different experiences in serving or different areas of expertise, but coming together forms an even stronger team. So for instance, in serving persons in carceral settings or interacting with the criminal justice system, organizations with experience directly in that area and organizations with, say, housing experience are coming together to serve persons involved in the criminal justice system. Same way for syringe access services, seeing organizations with a long history of providing sterile syringe services, now partnering with other organizations who have opportunities to do more work in that area, but maybe not as long of a history. So that forms a strong team. And then lastly, with older adults, organizations that have worked for a long time serving older adult populations and those who are more moving into that space, and also creating really interesting opportunities like providing naloxone to this community as well in novel ways. So I wanted to mention those partnerships and also to say that the priority populations contract managers who support and promote this network have been having the agencies come together and do spotlight presentations monthly and facilitating discussions on successes and challenges of the work and how the different organizations who are delivering those services can help learn from each other, inform synergistic partnerships at these monthly meetings. So a lot of information sharing of best practices and opportunities there as well. So really interesting collaborations that are emerging there. I think those were the main things that I wanted to mention. And just to say, I'm so glad that our Deputy Commissioner for Health Equity and Human Rights, Tina Kim, is on, Deputy Director Val White from the AIDS Institute's here, and our great colleague Shay Gonzalez is on as well. So collectively, we can try and answer any questions that come up for DOH. So let me stop there. And Connie, thanks again, and I'll turn it back to you.
That's great. Thank you, David. And I so appreciate what you're saying about providers being able to come together and leverage opportunity to try to enhance services and to kind of do more with the folks that are being served. And, you know, like we are all encouraging our providers within systems to do that. I think that the Opioid Settlement Fund has been a great opportunity for us to do that across systems as well. And so there, you know, I'm thinking of, you know, Evergreen and as one example of, you know, I'll say a quote unquote DOH provider or you know, funded DOH provider who also is receiving dollars as part of our outreach and engagement initiative. And it's nice to see the collaboration across systems and, you know, a more comprehensive, expanded, you know, approach to providing for folks and addressing the needs out there. So, so that I appreciate very much. I do want to give folks an opportunity to post questions if you have questions. I know we've had one come in, and also Amira, thank you, who tested the QR code and said it works. So thank you for that.
Yeah, the first question that came in, Connie, I just wanted to sort of let Kristen know that the two links I provided, the first one being the one that links you to the 2024 OSFAB presentation. Those are the Division of Budget tables where you can find the projections that go out in the out years. That was her first question. And then the second question is a link specifically to the regional abatement site on our website where you can see dollar amounts per county, which was the second part of her question. So, Kristen, I don't know if that fully answers your
yeah, so the question from Kristen was, how can we get a copy of the opioid settlement and abatement dollars that counties are receiving? So for that question, go to our website. Go to the Opioid Settlement Fund tracker. There is a section for regional abatement where we are providing that information. And then in terms of the second question, is there a document that shows the projected amounts they will receive over time? So Lucia gave you a perfectly accurate answer to that question. I only want to add that you will need to go to the Opioid Settlement Fund Advisory Board webpage on the OASAS website and go to the presentation documents that are attached for past meetings where you can find that information. And I do believe the most recent presentation by DOB was in September. I think it was the September 2024 meeting. And that is where you'll find those tables that Lucia is referring to. And I am certain, oh no, it was September 13th. So I'll even share my screen for folks to see. So I'm on the OASAS Opioid Settlement Fund Advisory Board page. I'm in the past meetings section. And if you scroll down to the September 13th, 2024 date, you'll see that there's a PDF of the Opioid Settlement Fund projected receipts by source. So that is the information that was presented by DOB, and you can look through those tables. It's a lot of information for me to digest. So I'm glad that we have it posted for folks to have a chance to kind of sort through it. Thank you for all of the links that were posted. Okay, and Kristen, she can't seem to click on them, but Kristen, if you have any difficulty accessing the information, please feel free to reach out to the Opioid Settlement Fund Project Management mailbox. I'm sure one of my team is going to drop that email address in the chat, and we can make sure that you get connected. Other questions that folks have?
And if you'll permit me, I'll just quickly say Shay also put in the chat her email and the drug user health email in general. So if anybody wants to reach DOH, that's a good pathway, or reach out to any of us. But Shay, thank you very much for including them.
And actually, Shay also posted the connection to the meeting presentation. So again, I'm going to share my screen for a moment. You'll see that on the same Opioid Settlement Fund Advisory webpage, under past meetings, February 27, 2025, you'll see that there's an opportunity where you can click to watch the meeting recording. And so this is where I was trying to entice you into utilizing the web page, because yes, this is where you'll see the presentation by Dr. Cunningham for OASAS, as well as Dr. Holtgrave for DOH. So in addition to the recording, you can also look at the presentation materials, the slide deck. So this is where you would find those goodies. And I do see that Chris Smith was able to join us from OMH. Chris, welcome. I did let folks know that you are in demand and would be joining a little bit late. So welcome, happy to have you here.
Thank you.
Any questions that folks have? While folks take a moment to mull over possible questions, maybe right now you're actually on the OASAS website or on the DOH website looking at all this information, which would be fantastic. I just want to remind folks that both OASAS and DOH are updating those web pages with additional information as we're making dollars available. We continue to work to get the funding out to the community, and again, I expect that in the coming few years, you will see more and more information with regard to the evaluation. I say years because we need time to collect data to be able to look at the impact of these services. And I know that there's a want to understand and see the impact, as soon as we make these dollars available. And that's why I think it's important to remind folks that it takes time to establish programs, to add, enhance, expand programs for the service delivery to be ongoing and that data to be collected before we can really speak to what is happening in a definitive way. We do want to rely on the data. We are a data-informed state. We are data-informed agencies. This is how we operate. This is what we do. And so it does take time for that. And it's exciting, actually, to think about the numbers coming in over time and are really being able to evaluate and dig into them. So do know that that will be work that is going to expand and grow over the coming years. I don't see any additional questions in the chat, unless I'm missing something.
Connie, there is someone with their hand raised. Would you like me to unmute them? Ramon Welsh?
Sure.
Okay. All right. Ramon, you should be unmuted.
I'm sorry, I did that by mistake.
Oh, okay. Thank you.
Sorry about that. Sorry about that.
No worries. He was waving. Ramon was waving at everyone, saying hello. All right. So David, Val, Shay, Chris, any other comments or anything else that you wanted to share this afternoon before we close?
No, just thanks again to OASAS and to everyone joining, and we appreciate making all of these connections and this opportunity to have these community conversations. So I just want to say thank you one more time, and back to you, Connie.
All right, terrific. Yeah, and thank you to the folks who joined. It does give us reason to continue with this. There's obviously an interest by folks out in the community to hear about what we're doing with the OSF, what is happening. So I appreciate folks joining. As a reminder, we do hold these meetings on a quarterly basis. You will get information about the meeting made available ahead of time, and I hope that everyone has a happy warm spring until we talk to you again, where we will be a little closer to summer if we're not there yet. So thanks for joining, everybody. Take care. Bye-bye.
Thank you.